I want to tell you a story about an average American citizen navigating through our country's healthcare system. It's not a story of tragedy nor drama, but simply an example of the frustrations that everyday individuals will encounter during our collective quest for good health. This is the story of a close friend of mine. Let's call her Kate. During a routine health visit, Kate's primary care physician uncovered a concerning test result. She recommended that Kate receive further testing immediately to rule out a life threatening medical condition. Instead of saying, "Yes, please refer me to a specialist immediately so I can treat this problem before it progresses," Kate's first response was, "What will this testing cost? I don't think I can afford to see a specialist." Now, Kate was lucky enough to have medical insurance through her husband's employer, but like many Americans, her family lived on a tight budget and had difficulty managing unexpected expenses. And seeing a medical specialist would potentially be expensive. As is so common, Kate's insurance plan came with a deductible that must be met before the company would put any money at all towards treating that, which was not deemed to be, routine or preventative. In her case, this deductible was $2,000, which meant that Kate would be responsible for the entire cost of an office visit and any subsequent bills she had spent, totaling $2,000 out of pocket. After that, her insurance would pay 80% of her approved medical expenses for the remainder of the year, only to start Kate back at zero the next year. To mitigate this deductible cost, it was standard practice for Kate and her husband to postpone seeking treatment for any health conditions they felt were non life threatening enough until enough medical emergencies had occurred to eat away at that $2,000 requirement and allow their insurance to kick in. This was $2,000 each, of course, and often their health and problems got pushed aside for years until circumstances caused Kate or her husband to meet their deductible and finally be in a position to seek care without taxing their budget to the breaking point. In a case of Kate's need for specialty testing, her doctor advised her not to wait. But being sympathetic to Kate's financial concerns, the doctor offered to do the procedure herself in house, as a primary care office visit is generally cheaper than seeing an outside specialist. But was the primary care doctor really cheaper? Kate's finances demanded that she find out for sure, but the answer to this question was far from simple. First, it required asking her doctor for a list of the specific medical codes connected to each portion of the procedure she would need. It is typical for one combined medical bill to break down into several codes. For example, a code for a specialist consultation, a code for a doctor's time performing the first step of a procedure, another code for the second step, a code for the equipment and room being used, and a code for the lab that will process the test results. Armed with three different codes, Kate called her insurance company's helpline to get assistance with finding the lowest prices in her area. After it wasn't in the insurance company's best interest to inform their clients how to spend less on healthcare, the insurance representative was helpful, but taken aback as it was not common to have such conversations with a well informed client. Most people are unaware of their ability to shop around for medical care, so they simply march in whatever direction they are pointed without any further investigation or comparison shopping. After taking charge of her own health care, Kate was directed to a database where she could input the procedure codes and see the negotiated prices set by insurance providers and clinics within her insurance network. Kate was surprised to find out that the results were not all over the map, with no consistency from one clinic to the next. And this is, unfortunately, by design. And sorry. This is, as I said, this is a close friend. Um, okay. Now, the insurance company obviously could see an entirely different set of results based on the plan negotiated between the insurer and their own employer. This story has a happy ending for Kate. First, she found the least expensive doctor to perform her procedure, which happened inexplicably to be an award winning specialist in the field. And then the test results showed that the initial medical concern was only a false alarm. Kate was relieved to be declared healthy but even more relieved that her condition had not led to further testing and procedures that she would struggle to afford. The biggest cost for Kate had been in her time and frustration dealing with a health system that is. Hold on, please. Not designed to be user friendly or to even make any sense. Many people, of course, are not so fortunate. For others, the cost of medical procedures, life threatening conditions, irrespective, the complication of insurance coverage, and the myriad of flaws, if you want to call them that, in America's healthcare system can lead to great pain, suffering, financial ruin, and often even death. Remember in the beginning when I said that Kate's story wasn't tragic and dramatic? Well, I lied. Fast forward a few years, and now Kate has been diagnosed with a terminal illness at age 47. It was a condition that would have been entirely preventable or treatable had it been caught early. But it went unnoticed because insurance companies have chosen not to cover standard blood tests that will identify people with genetic disorders that drastically increase their odds of developing aggressive forms of cancer. They did the math, and they decided it's cheaper to pay the bills for a few extra cancer patients than to spend money preventatively testing all of their clients. The problem with healthcare in America stems from a system that treats illness and wellness as just another object of commerce, a service to be marketed, sold, and purchased. It is a system that measures success not by outcomes, but by another metric altogether, revenue generation. Healthcare in America in a little over a quarter of a century has devolved from a once caring endeavor into the most profitable industry in the United States. A transformation that, by the way, progressed sector by sector, expanding into what we now know as the medical industrial complex. In centuries past, medicine involved an intimate relationship between physicians and the patients that they treated. It was a relationship premised on trust, compassion, and ethics that heeded the principles of do no harm. In a relatively short span of time, the field of medicine has become a highly profitable business, a business riddled with unnecessary middlemen, kickbacks, malicious billing, and skyrocketing cost. It is a dangerous and vicious game where industry stakeholders, often with no training in medicine, use fancy business degrees to devise these schemes to generate high profit margins, yet substandard care. These schemes involve marking up the price of medical care, then secretly discounting it, depending on who is paying. Two patients, for instance, arriving in the same emergency room with the same symptoms and diagnoses, receiving the same tests and services, will be billed different amounts depending upon their insurance coverage. A sonogram of the heart costs anywhere from $1,000 to $8,000 in the United States. The 2014 negotiated fixed price in Japan and Belgium, under $150. To fully understand the absurdity of our healthcare system and the exorbitant cost, we need only compare the cost of care with other developed nations. It is through this analysis that it becomes blatantly obvious that the American healthcare system is rigged against the patients, turning seeking medical attention into this crapshoot with less favorable odds than a Las Vegas casino. It is a system that has created its own refugee crisis, with a growing population of middle-class Americans fleeing the United States to avoid the unbearable and often fatal costs emanating from our for-profit healthcare system. In her book, In American Sickness, Elizabeth Rosenthal documents stories such as a graduate student with diabetes who is searching for academic positions in other countries because even with insurance, she can't afford treatment in the United States. Or a teacher from Oklahoma who moved to Brazil after a cancer scare made him aware of his financial vulnerability. Then there's the college professor in Michigan with a Canadian passport who took his child back to Canada for complex cancer treatment because the cost would have been unsupportable where he works. A professional half German, half American family who, with mixed emotions, relocated with their 3 sons to Germany after well over a decade of residency in Tucson, Arizona, because they were worried that they wouldn't be able to afford health care and university tuition at the same time in the United States. The honored heritage of public trust that was once the hallmark of medicine has morphed into a complex business model and a fragmented system that generates high profits and great casualties. But beyond the inflated price tags, insurance companies also have the power to decide for patients which services and treatments are and aren't medically necessary. Again, often with no medical training whatsoever. We've all heard stories of Americans who are denied the healthcare coverage that they need, but the lesser known flip side is the very common practice of over-treating patients. Many people are being prescribed care that is not only unnecessary, but often puts their health in danger. This travesty begins in the hands of the many players who set the prices for medicine, and then extends to the insurance companies who dictate which claims they consider to be valid, and finally lands in the laps of doctors who work directly with patients and steer them, somewhat blindly, towards specific treatments. While I assume that most doctors are caring people with a genuine concern for their patients' health, far too many get corrupted by a system that allows them for easy avenues to pad their own pockets. Today, the practices of over-testing, over-diagnosing, over-treating, and inappropriate care are now quite commonplace, more so in some areas of medicine. One such example is the field of cardiology, most specifically the practice of ballooning and stenting, which involves the insertion of tiny inflatable devices into the arteries to spread open blockages that restrict blood flow. Now, it's a life-saving intervention that has been around for many decades, but until recently, this procedure was primarily limited to heart vessels. Now, this procedure is becoming more routine, with the ballooning, stenting, and lasering of harmless plaques and leg arteries becoming a cash cow. Even as studies showed that such stents provide little to no survival benefit. In 2014, a $37 million settlement was reached in a case where Dr. Mark Madej, a Baltimore cardiologist, stands accused of allegedly placing unnecessary stents in as many as 273 patients to receive payments of over $100,000 per procedure. Dr. Madej's medical license was revoked in 2011, but he is by no means an outlier. Perhaps what is most alarming is how some physicians are recruiting their patients. Since few patients, after all, even know about these procedures, let alone decide to book them to have screening that measures the blood circulation in their legs, some medical professionals will attend community health fairs and perform predatory screenings, resulting in referrals for these unnecessary procedures. Patients are told these stents will improve their circulation, or even prevent an amputation of the limb in the future. Tactics, of course, meant to scare patients into receiving care that serves only to improve the provider's bottom line. This isn't practicing medicine, it's prospecting. One study reported more than 1,100 churches, synagogues, and mosques in the United States alone served as these vascular screening centers, despite a scientific consensus that people should not be screened in this way. In an anonymous survey sampling of 3,000 physicians across the country, doctors responded that they believe 21% of everything done in medicine is unnecessary. Broken down, physicians estimated that 22% of all prescription medications, 25% of all medical tests, and 11% of procedures are unnecessary. The aforementioned stenting of leg arteries can generate $100,000 in a single day, while a physician performing cancer surgery only earns around $2,000. So it's easy to see why some greedy medical professionals might focus their time and energy on providing care that doesn't actually help patients. Our for-profit medical system incentivizes certain types of care over others, regardless of whether the patients need the treatments or procedures. Consider another example. At least 3 trials have been published in top medical journals showing that treating appendicitis with antibiotics instead of surgery works 75% of the time, with no increased risk to patients. And yet there are over 300,000 appendectomies performed every year, each with a substantial price tag. And whether patients choose antibiotics over surgery, well, that largely depends on the way their surgeons present these options. While there is much blame to assign from unscrupulous medical professionals, the greedy pharmaceutical industry, and the feckless politicians who are more loyal to their donors than their constituents that they are elected to serve, We too, as patients and citizens, bear some of the blame. We have become far too complacent, left entrapped by a state of helplessness. It's time to use our voices and our votes to take a stand. We need to embark upon a new age of empathy, where America's medical system ignores profit in favor of honest and genuine healthcare for its citizens. And now, my friends, is the last word up front. I'm Sean Sainhart, and you are watching Coup Save America. Stay tuned. We've got a great show as we continue this conversation about the cost of healthcare with our returning guest, Don Lehrman, who's also known as the Health Care Voice. We'll be right back. The U.S. Supreme Court ruled recently on the government's use of the state secrets doctrine in an opinion that will make it easier for intelligence agencies to evade accountability in future individual rights cases. The case involves a detainee at the Guantanamo Bay who was subjected to numerous acts of torture at a CIA black site. The detainee had filed a request for information related to his treatment, a request that was, of course, denied to his legal team under the guise of protecting national security. 7 members of the court joined parts with an opinion siding with the government, with only Justice Sotomayor and Gorsuch dissenting. The case has implications for other torture-related cases and for government accountability more broadly as it expands state secrecy to powers based on a doctrine that was already overbroad and suspect in its origins. In the course of seeking a tribunal that would hear his claims, Zubade asked the Polish government to investigate the criminality of interrogations that took place at a CIA black site in Poland, Ster Kadecki. Probably not saying that right. Since much of the supporting evidence was located in the United States, Zubade had to petition a U.S. District Court for an order compelling its production. Federal law allows for such a petition, but when it was filed, the U.S. government objected, citing the state's secrets doctrine. The case worked its way up to the Supreme Court, and the court ruled for the first time in years on the scope and application of the doctrine. Now, in related news, privacy advocates are sounding the alarm after a draft opinion leaked from the U.S. Supreme Court suggesting the court is, of course, set to overturn the landmark Roe v. Wade case legalizing abortion. Now, in seeking to further understand how this ruling might impact Americans, a new report from the Surveillance Technology Oversight Project, known by the acronym STOP, lays out the many ways police, prosecutors, and private litigants will be able to utilize the existing surveillance infrastructure currently in use as a mechanism for tracking and enforcing state abortion bans. Quote, none of the tactics we will see used to target pregnant people will be new, says Albert Fox Kahn, executive director of STOP, the Surveillance Technology Oversight Project. He continues, we've seen these same surveillance techniques developed in the name of immigration enforcement, national security, combating drugs, and so many other law enforcement priorities that go way beyond what they were intended. And the truth is that when you develop those techniques, you're at the whim of those in power and whatever they next decide to call a crime. Stott believes that the most likely abuse practice used to combat potential abortions would be something called a geofence warrant. Now, this is when a law enforcement agency requests bulk data from cellular devices that are based on your location during a set date and time. Thanks to how online technologies collect massive amounts of data about consumers, the data obtained from a geofence warrant could easily lead investigators to surveil women who may be seeking or may have gotten an abortion despite no longer having a federal recognized right to terminate a pregnancy. In addition, the Surveillance Technology Oversight Project warns us that pro choice states should be concerned about their participation in federal data sharing initiatives that allow multiple law enforcement departments to enter and share information into nationwide databases. Obviously, this sort of cooperation is beneficial in many ways. For example, providing a greater ability to recognize murder patterns and catch serial killers, including combat terrorism. But these same data sharing services could be expanded to monitor and investigate reproductive care workers and people who are pregnant. It could become a similar situation to the controversial policing practices of the U.S. Immigration and Customs Enforcement Agency and their newfound and legendary abilities to track and deport undocumented residents using these data collection and sharing schemes. STOP also warns us that law enforcement agents have even stooped so low as to create fake social media accounts that trick people into revealing their interests or intentions. And this is another tactic that can be used to target women and assist with abortion investigations. The STOP research shows that while individuals can take steps to protect themselves and their data from prying eyes, structural change and legislation is still needed to shield less informed citizens on a broader basis. For more information on how you can protect your privacy, please visit the Surveillance Technology Oversight Project via their website at stopspying.org. That's stopspying.org. And this wraps up this week's news that wasn't in the news briefing. We're going to be bringing in our returning guest, Don Lehrman, to continue our conversation about America's healthcare crisis. First, I've been getting a lot of questions about what I'm wearing. And since clothes doesn't seem to be a satisfying answer to most people, I want to give a shout out to ASOS. ASOS, the official attire of Coup Save America. ASOS has an amazing selection of clothing for both men and women, so please check them out at asos.com. Finally, I want to just give a shout out to my mother, Kathy Abbott. She's watching in Bangor, Maine. And I also want to wish my father and all fathers a happy Father's Day. We're going to take a really quick break, and then we're going to be back with Dan Lehrman. We'll be right back. Okay, let's bring Dan. Our good friend Dan Lehrman. He's the healthcare voice. How are you today?
Well, I've been texting a little bit with you. I'm good, thank you, and I hope you're better. Uh, I was texting a little bit with your producer. I know that you accidentally called me Don, and I wish I had a twin brother. We would have got along great, Dan and Don.
I'm sorry for that.
No, it, it,
I'm
well,
probably getting your last name
you
incorrect
Lehrman
too.
is good, but if I can't make fun with you, I don't know who could. So.
So I'm I'm a little furious. Obviously, in my monologue, I was talking about a good friend of mine,
I
and
was there with you, by the way, and I can't imagine, doing a live taped, monologue, and then all of a sudden, kind of being overwhelmed with a lot of feelings, including warmth and love and caring. And we've all been there. And we have sometimes these unexpected and unanticipated mini meltdowns, either under the best or worst of circumstances. I'll just share with you that, and then I'll sum it up. I've been there as well.
yeah, thank you. Yeah, I obviously worked on this monologue, and so I knew what it was. It just it very emotional because this is someone that I care very deeply about, and there's and I can also imagine all of the other people out there that go through this same nonsense every day in this country, and it really comes down to these corporations that are deciding that it's more profitable for them to how is it really not murder, right? They know what they're doing when they deny care and impose these ridiculous loopholes that people have to jump through. I mean, they know it's killing people, correct?
Well, you have to make an assumption that what you're talking about would pertain to people with uh, what's historically known as conscience. And then I'll add on to that some other, very common words: uh, integrity, human dignity, empathy. The list is short, but I think we all know what those words are. And I'll even throw in the M word, morality. So you say you're really saying, well, what do people that actually make decisions like that are predictably or statistically going to have a bad outcome with, say, a certain percentage? Clearly, not everybody. And how do they go to sleep at night? What a you know.
I'm going to put on these other headphones here because I'm having a hard time hearing you.
Well, that's interesting because
Oh, much
I,
better.
I was having a little difficulty hearing you, but then you got louder, and we're good now.
Yes.
I can actually make an effort to speak louder if that helps.
Oh no, it's I can hear you perfectly now. I just had to put on a
Okay.
different set of ears.
No, that's good. So yeah, there's different degrees of murder, all the way from first degree to whatever the courts say, second degree, third degree, voluntary, involuntary, collateral damage. You know, uh, and this hasn't been going on, just recently. This has just been building up, as we've talked about before, since 1974, when it became legal to make a profit, or any kind of profit, as we see today, off of the backs of accidents, illnesses, diseases, and so on and so forth. So we identified the last time that you and I were together that profit over people in the healthcare landscape of America with the huge corporations that are beholden to their stockholders, and that includes hospitals, that includes medical device corporations, and then the pharmaceuticals. So,
Yeah, last week we had a gentleman who is the author of a book who was talking about just corporations in general.
I'm glad you brought him up
Um,
today.
and yeah, it was fascinating at
Hmm.
how corporations have amassed so much power compared to what it used to be. And that's essentially what we're talking about here too is in healthcare a handful of corporations and again let's as you and I discussed um, these companies that the argument for instance against Medicare for all is oh well the pharmaceutical companies they need to make a profit otherwise they can't innovate or eh, but that argument falls flat when you look at what other countries are doing. And also, what people don't understand is a lot of the technology, including pharmaceuticals, including vaccines, um, they're funded with tax funds. They're highly incentivized with tax funds. So we're kind of paying twice
Hmm.
for many of these medical interventions. Um, and it should not be about profits. That's not what healthcare is. That's not I mean, like the cardiologist that I was talking about, who's going to these churches and synagogues, right? Preying on people at these health fairs and saying, hey, even though, well, of course, they're not saying that there's no scientific evidence for this, but they're like, hey, you know, we should do this screening because it might prevent you from having to have a leg amputated in the future. Well, when somebody hears that, of course they're going to want that screening. And when that screening, of course, comes back and says, you really ought to have this procedure, and if it's a procedure that the insurance, and that's what I wanted to ask. Why would it be so easy? I mean, for like these stenting and ballooning, why would insurance companies be so eager to pay for that, especially when there's no scientific evidence to support that it's beneficial, and yet there's other things where they won't pay. I don't understand that. Wouldn't it be kind of like, hey, we're not going to pay for anything that we don't have to?
Well, I'm going to answer your question a little perhaps unexpected or a little sideways. But first of all, let me talk about the screenings in the churches and the synagogues and so on and so forth. And at times, and I don't know what the numbers are, preying, if you will, on the fears of people. Well, that's just that's just it's just predatory, parasitic healthcare. When the example that you gave or examples arise. However, uh, I don't know what percentage of these screenings that you talk about are done to the most ugly extent that you bring up. But let me say a couple of things as I organize my thoughts. I think healthcare, the concept of mass or large numbers of healthcare screenings, whether it be in churches, synagogues, nursing homes, assisted living, and so on and so forth. The concept of preventative health in our country is a fantastic concept. And in fact, I thoroughly, having worked in healthcare for a long time and having been a patient myself, as we all have,
Yeah.
with one thing or another. I fully support healthcare screenings. I just happen to, just for educational purposes, I drew up a little list of appropriate healthcare screenings, but then I'm going to add where it can and does go sour.
Okay.
We have, for instance, today, one of the highest incidences of colorectal cancer in people in their 40s. Now, those who are in the know or who think they're in the know, and I'm both, these higher incidences of colorectal cancer in people now in their 40s are due to what's going into our bodies. There's no ifs, ands, or buts about it. Plastic, chemicals, whatever. Okay, so we're not going to change the nutritional food chain on this show, but doing preventative tests, I'll be silly-ish and talk about the poop on the popsicle stick test to see if there's any microscopic blood in a person's poop. Do it, because colon cancer, if gone too far, uh, it's not a good outcome. It's really not a good outcome, and I've met a lot of people with not good outcomes. And then my own stepbrother, who didn't pay attention to regular abdominal pains and maybe some dark stool, died of colon cancer in his 40s, maybe 20 plus years ago. So let me move right along after colon cancer screenings, breast cancer screenings, mammograms. There's a great debate in our country about, well, how old should a woman be when a woman should have a routine mammogram? And I'm not going to claim to be the expert on that. I'll let people talk to their doctors, their nurse practitioners, their physician assistants, et cetera, and find out what's good for them in terms of family history and so on and so forth. And by the way, there are some excellent articles out there that do talk about if there is something visible in a routine mastectomy, it may not have to lead to an aggressive uh, surgery, a mastectomy, my bad. There sometimes is a wait and see kind of approach for some women, but you have to go to a trusted healthcare provider to make those decisions.
Yeah, I've certainly read a number of those articles on the
Good.
controversy as to when to get those screenings and when not to. And what I kind of found fascinating about that is that a lot of times these mastectomies are themselves um, performed sort of unnecessarily. Um,
Right. And then there is the double mastectomy that is done prophylactically or preventatively when women have been identified as, through genetic testing, that the probability of developing breast cancer, and that's without any metastatic lymph node involvement, uh, women are having double mastectomies because they saw what happened to their mother, their aunt, their sister. So again, it comes down to what you were talking about, how healthcare used to be and still can be, by the way. We can't scare everybody away. When you have a trusted healthcare provider, based upon all the variables that can be involved with that, then chances are the do no harm, you have much greater odds of that. And I don't want to take up a lot of time anymore about the screenings, but again, cervical cancer screening, very important for women.
I just want to
Diet,
add too on breast cancer that, and a lot of people might be surprised to hear this, but men can get breast cancer as well,
oh, absolutely. Thanks for bringing that up. I've only
and
had,
testicular cancer as well is another thing that doesn't get a lot of screenings.
that's a good point. And I appreciate your adding on to that. You know, we talk about in our healthcare system of infant mortality in our country versus other countries, and you know, we have nothing, you know, to be proud of
Mm-mm.
with our infant mortality rate, especially with minority people. So again, in terms of screenings to improve upon those statistics, you can have screenings of pregnant women, uh, hepatitis B as an example, and other high risk medical background problems. Then, just to move along quickly, diabetic screenings, especially for people who, for whatever reason, are either overweight or very overweight or have what's known as morbid obesity. Uh, People, again, screenings for people that have smoked or do smoke, but especially for people that have smoked with a history. Even if they haven't smoked in 15, 20 years, there's a diagnostic test available for having an abdominal aneurysm.
Oh, where is there?
Yes, there is. And then, by the way, there are some pretty sophisticated tests for ex-smokers to do a chest X-ray that is a way above and beyond the technology of going to a place that can do a routine chest X-ray, which they're rarely done now. But that technology is there. So let's go back to the synagogues, the churches, assisted and doing the routine screenings because these topics are near and dear to my heart for many reasons. They're great. It's the problem. And by the way, I want to talk about the heart stents. And I have no problem in sharing with you and the public. I have 4 stents in my heart.
Okay, well, let me. I probably didn't clarify this. These are not the heart stents. These are. It's a
Oh, in the
you
legs.
in the legs, right?
Okay,
And
all right. So fine. So now everybody knows I've got 4 stents in my heart, and I'm 75 years old, and here I am.
yeah, no, the heart stents are that's a proven science. The
Okay,
leg
no, the leg
stents,
stent.
however,
No,
are
that's good. Although I'll have to tell you, because I've worked in healthcare, when I had was having pains, you know, and I have to admit, I'm probably more sophisticated than a lot of people because why? I've worked in healthcare, but I've met a lot of healthcare providers who have had other healthcare providers, and they make mistakes, not on purpose, but you know, so it's a different culture. But
well, and the system provides for those mistakes to happen. I mean, you've got doctors that are overworked. You've got doctors that themselves
you
don't
look at
understand the
medical error.
system. Exactly.
What's the number one cause of it? I mean, hospitals, you know, are the number one cause of death. Not that if you need to be, I'm just saying it's because they're overworked, do more with less. That's how all these medical errors take place. They've happened to me, by the way, and they've happened to almost everybody in my inner circle. So it's not like, oh, these are outliers. No, it's happening everywhere. So thanks again for, okay, so the heart stents, fine. The leg stents. All right, so look, personally, I had pain in my calves. I had pain in my thighs. Uh, I have a stent in each kidney. So I could have circulatory problems because why? I'm a type 2 diabetic. I have hypertension. So actually, I decided that I think I should have what's known as the Doppler. And sure enough, I have some issues, circulatory issues. However, I'm in good hands. Nobody's going to say, in fact, they have said, well, no, we're just going to, maybe we'll do this test every 3 years to see if there is a possibility that you might. But to scare people and tell them everything that you were talking about, it's tragic. It's just beyond tragic. And here's where I was going at the beginning of my spiel here. Screenings are excellent. It's when after the screenings people take purposeful advantage of the screening and turn a small problem or no problem into a small problem, or take a small problem and turn it into a large problem, and that the only incentive to do that is financial. That is tragic. And so we'll go back to how do people sleep at night when they do that? You know, uh, having profits over people. Well, that's a big problem. Problem is not even the big enough word. The last time I was with you, I shockingly said to myself and your audience, Medicare is built per year approximately $60 billion a year. We don't talk about that. We can talk about waste. But that waste is like overkill because what of what we're talking about, and that is to double physicians. They're extremely fearful of litigation, and so that's why we've seen over the years more and more aggressive and sometimes invasive procedures so that a mistake isn't made, so that they don't get sued and it looks bad on their report card. So then it gets balanced by you have a lot of people who, over the last 10, 15, 20 years, have made a career of seeing to it that legitimate litigation over wrongful deaths, uh, huge mistakes in medicine. There's been caps put on how much now certain people, patients, can receive for what you would call a legitimate sum of money in terms of, well, how much is a person's life worth? What if they lost 20 years of salary? Not do so much to, the balance of this is philosophical, human error versus just like, well, you're doing too much, too fast, too soon. And why are you doing too much, too fast, or not doing, because you're driven by your salary. I'm as frustrated as every other person that's listening to this as it can possibly be. And whenever you whenever you talk with anybody who's worked in healthcare, you always have to think about something. Do they work for a hospital? Do they work for a nursing home, etc.? And the secrets. You try and go through channels in a medical institution to solve problems. And sometimes what happens is if you don't go along to get along, you're a troublemaker and you get
Hmm.
blackballed. Not necessarily by being a whistleblower or a quasi whistleblower, which, by the way, I would do it again. I was at the VA Medical Center where really bizarre things were going on, and I didn't look for them. They were just like in front of my computer, just like you and me. And I just wasn't the type of person to sit back and say nothing. And when I did try and talk through channels, it went nowhere. I don't encourage people to be whistleblowers or quasi whistleblowers. I'm just saying that in medical centers and hospitals, when mistakes are made, uh, it, it can be an educational process for learning, or you just want to run out the door and say, I wish I never came to work today because of what I've seen and witnessed. Short story. There's a tremendous crisis in labor in our country, and it's not always about, well, we're not getting enough money. You can't find enough pilots. They earn a decent living. They knew years ago there was going to be a shortage of pilots, and then COVID came. So now you see the news, everything that's going on at the airports. Same in hospitals with all the nurses that are burnt out.
And
You have
doctors too.
doctors too. Yes, yes. And housekeeping. You have all these layers of people that form a system. So I had a friend recently that had a mild heart attack. His room wasn't cleaned up for 3 days. And this isn't a pretty, allegedly good hospital. They changed his garbage pail once in 3 days, but the sheets, the floors, no. So, and by the way, I was discussing this with a physician. There's, they can do something about that if they wanted to, because the hospitals are Medicare certified. You don't want to have infection control problems and be fined. It's avoidable. It has something to do with the concept of bottom line and do more with less.
Yep.
If I were employing a, a little pat on the back for housekeeping, you want to work in a hospital for $11 an hour, $14 an hour, with a family of three, doing wonderful work, keeping a room clean that you're sick in and recovering from surgery. Well, maybe they should raise the wages for housekeepers. I'm sorry, I'm
Absolutely.
laughing, but you know my personality. You
No,
got to make light of these things too.
it's insane because, well, now I imagine part of the other problem, and that kind of goes back to what I said in my monologue too. You've got people running hospitals; they're not trained in medicine. They're trained in economics or, often cases, business management degrees. And hey, that's great, but nothing against MBAs and all that. But when you're running a hospital, it you would think that you would be required to have at least some education in medicine to be able to make those decisions and weigh those risk factors. But again, it's becoming more and more of a business, and very few doctors and nurses actually even work for hospitals anymore. It's all contracted out.
Yeah, I know. What we've seen with COVID is that there are nurses now that weren't treated very nice at the hospitals that they were employed by, and they got burnt out. And all of a sudden, they're doing exactly what you're talking about, but it's caused a tremendous problem. You have traveling nurses who are, this is not an exaggeration, they're making $200 hour, an hour, registered nurses. Of course, you go in and every time you're in bed for 24 hours, you have a different nurse. Uh, they're expected to know exactly what's going on, that they're expected to read your medical chart, and and, and so you wonder, why are there so many medical errors? Well, these I said the last time I was with you, we can have the best healthcare system in the world. We got to the moon, but if you're going to put money
Did
over,
we though?
yeah,
Did
what's
we
that?
really get to the moon? There's a
Did we
controversy.
get to the? Well, maybe the Earth is flat. I don't know.
Until I see a picture from outer space, I'm going to go with flat. Oh wait. Anyhow,
All right, so we got to the moon. Why? Because we put our mind to it. And if we put our, it's not going to happen in my lifetime, but if we put our mind to it to have the best healthcare system in the world, I'm telling you, we could. You yourself had brought up something which I really wanted to bring back. If we took the best people from the countries, the industrialized nations in the world, who have uh, single payer health care or close to it, whatever. If we took the best from Canada, Germany, the Scandinavian countries, and, had a task force, a real task force, you know, we could do it. The problem is, I think I sent you an article that there's so much money spent on healthcare that people are two things they're afraid of. We can't have Medicare for all tomorrow because we don't have the staff for it. I mean, the system would be flooded, and then you think medical errors are big now, so that's a real issue. But but we saw the writing on the wall 25 years ago. We just decided, like global warming, well, maybe another time, or maybe when the economy is better, we can have more social programs. It's very sad. What would you like to ask me today before I run out of words?
Well, I've done a lot of I've read several books about our healthcare system, and a
Yeah,
couple were dedicated and focused primarily on the Affordable Care Act. And
which I didn't like, by the way.
no, me neither. Now, and the
Okay.
more that I've learned about this, and here's what surprises me: the the narrative that we were sold as the American people, or the belief was that the insurance companies and big pharma and all of these various, sectors were opposed to the Affordable Care Act, that they fought tooth and nail against it. But the reality is that's not the case at all. They were heavily involved in it. They were, I remember, and one of these books was written from someone that was actually inside the Obama campaign. So this is not a right wing, Republican that's just, wants to make a fuss about it. And he was talking about this how it was orchestrated, where there was going to even be these oppositional commercials that were aired, these public service announcements, and the Obama administration and the insurance companies were both working together. Like, okay, well, we're going to say that we hate this about Obamacare, and then you're going to target us. I mean, it's insane how orchestrated this was, and the idea that, I mean, I take issue with the Affordable Care Act just being called affordable, which is just not the case at all. Now, look, it's done a lot of good in many areas,
Exactly.
but
But
um, it hasn't solved any of the core problems that it was meant to. Now, sure, there are more people insured, but what people have to understand is, like with my friend, being insured means nothing if you can't use the insurance that you have, or you can't afford the insurance that you have. And a lot of people are paying, what was it, something like, and I mentioned this when we talked before, I forget the statistic, but it was something like, I think it was over 30% of people's household budget has to be put aside just for health insurance and health expenses in this country. I
that
mean,
is
that
true.
is
In yeah, that's not every family, but obviously.
so. And the Affordable Care Act, of course, we've seen is, you know, it's just incredible to me how there was no sincere effort really made with the Affordable Care Act to actually bring forth a system. It really was just a financial handout to the very industries that we're supposed to be protected from.
You've made your case.
Well, I was hoping that you'd say I was wrong and that everything's going to be okay. No, but
Well,
you know,
I didn't. The it has done great things for a lot of people, but I for whatever reason I saw the writing on the wall, and I didn't even know how bad it was going to be. And but I've seen people that they wanted to buy into it, but it was $500-600 a month that they didn't have, and rent, and so on and so forth. The our government spends 24% of its money right now on health care. That's a huge amount of money. People, consumers, they spend a very large 8.1% of their money. Well, now think about that. 8%. Well, if let's just say, I'm just throwing this out. Let's say you're a family of four, and your income is $40,000 a year. Now 8% might have to go towards health care. So back to what we're talking about, our country spends more money on health care than any other industrial country in the world. And to add insult to injury, we don't have better outcomes.
No, not at all.
I mean, in certain select what we have is, I mean, we truly have a caste system in healthcare. And it's not just the haves and the have-nots. It's the very haves and the very have-nots. And then that is a huge, like, different planets in terms of ex- access to affordable, quality healthcare. And then everybody in the middle. So here's what's always troubled me for the last couple of decades, and it's not going to go away. You're sophisticated enough, your friends are sophisticated enough, I am, my family, my friends, that we can somehow, through luck, skill, education, we're able to kind of navigate a little bit better than a lot of people. That's assuming we all have our marbles. Well, I don't mean to be rude, but there's so many people, they don't have the skills, they don't have anybody talking for them, advocating for them, and because when folks who are privileged to have better health care, better access to health care, better quality of health care, even now, all those things are being suppressed because of what's happened recently with COVID, and the system has just gone haywire. Plus, the corporations want to continue to make as much money. That's more. But for people that don't have the skills, the education, the whatever, they they're the most vulnerable. And if you even have mild cognitive impairment, and you just very mildly have difficulty in making decisions and doing problem solving, and say you're 65, 70 years old, and you're kind of, don't have a very good support system. Well, there's really tens of millions of people like that in our country, and they can easily be taken advantage of by, I hate to use the words, the predatory, parasitic healthcare components that exist in the United States. It's not pervasive, but $60 billion in Medicare, where did that come from? Sorry.
Yeah, no, and okay, so there was a study recently, and there's been several of these, but I think the latest number is that something, if we had Medicare for all
Yeah,
during the COVID pandemic, something like 300,000 lives uh, would have been saved.
340, but
340. Now,
for what?
I would argue that that number is actually larger. I've seen other studies because I mean we're forgetting that there's a lot of other components to healthcare. So I'd be a little bit more broad in my assessment, but let's just go with the 340,000 figure. Um, Part of the argument and part of the problem, I think, with Obamacare is that a lot of people have. They're not. You look at the mainstream media and you see a great deal of lauding of the Affordable Care Act. I mean, and so people are convinced, like when you hear politicians talk about it, for instance, like Hillary Clinton's thing was, no, 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 Medicare for all, that's never going to happen, but we should build on the Affordable Care Act. And how realistic is that? Because,
Hmm.
and what would that look like? And are they being, I don't believe that Hillary Clinton or these other politicians are sincere in their effort to get us to a Medicare for all system. This talk about all this incremental, we have to build towards it. I just don't believe that they're sincere about that.
Well, there's nobody that I know of in the political arena other than Bernie who I'm just going to say that Bernie was my guy in terms of healthcare. However, I would have appreciated, as many people might have, if he had said that we can have the best publicly and public and corporate funded healthcare system in the world. Because as soon as you start tossing around the word free, well, people would say, "What do you mean free? It's not free. Somebody's got to pay for it." Well, it's true. So, okay, all right, I got that off my chest. Thank you. But there's nobody today that it's now the political. Look, Hillary. Okay, as we know, there was a time when she really, and I think she was sincere about having a single payer healthcare system, and she didn't. Okay, so she didn't get burned over trying to pursue that. She got scorched. She didn't get baked. She got fried. She hit the third rail of donors, corporate donors, pharmaceutical donors. There was a wave of tsunami money up against her, and her she turned her story over on a dime. And so you see all the people that showed up at Bernie Sanders, events throughout the
Just a
United.
few people.
Pardon?
Just a few people.
Yeah,
No, not a, nothing that filled up stadiums of people or anything. Just a few people showed up.
yeah. You know, I can make another joke now about who said they had a big crowd, and they did.
Ah, yes. No,
So,
that that I have to say in both 2016 and 2020, you looked at that and you're like, wow, things are real. I mean, you couldn't help but be inspired. It was like I had never seen crowds of like that turn out for a politician,
yeah,
and
well,
yet
so
somehow,
what do I hear now? I mean, it's so ironic. I'll hear like, well, yeah, but look at their age. So, yeah, look at their age and look what's resonating in their brains and their hearts. So, money may not be the root of all evil. Love of money may not. I'm just, but money's the problem here.
oh, absolutely.
I mean, there's just everybody knows. It's just like when they say that you can't squeeze blood out of a turnip. Well, somewhere there's a metaphor there about healthcare that I'm not even clear about myself. But
But this is part of the problem with preventative health care as well. I mean, I've heard stories of people that, for instance, with breast cancer, um, there's a patient that I read about who knew she felt a lump, she had a family history of breast cancer. She knew, and she knew that as she went to the doctor, and she this is a black woman. She had insurance, um, but she put it off and put it off because to her, it was a death sentence.
like
And she
now,
couldn't afford to take time off, and eventually it got too late and
right.
it became terminal, and she died from this. And you hear these stories of people like, I'm afraid to get even the preventative testing because I know that I can't afford to do anything about it. So it's better just to not know because I'm not going to be able to afford to have the treatment
Yeah,
to even.
and I'll there's kind of like indirectly getting to a point that I made earlier that there wasn't enough people in her life to perhaps introduce her to some community resource center, maybe funded by whoever, to there are it's a double-edged sword. We want to see a single payer healthcare system that takes care of, let's just say, almost everybody. But it's then you have all these tremendous nonprofits out there, all competing for fundraising, and who would knock that? But but then about 2 years ago, I actually saw a registered nurse who worked in administration, and she suggested that the woman that was just recently discharged from the hospital with a humongous medical bill start a GoFundMe account. This is from an administrator of the hospital. A GoFundMe account. Sometimes, there's a place for them, but sometimes I just feel like saying, well, I would have told her, why don't you go start a what account? You're
Yeah.
gonna have. I'm sorry, you know.
No, but you see all of these GoFundMe campaigns, and you've got these basically sad stories competing against sad stories, and
Oh, corporate
it's
America loves that.
oh yeah, they consider them these feel good stories. They're not feel good stories. I mean, the Girl Scout that had to go and do her own bake sale because she wanted cancer treatment. That's not a heartwarming story. The way the news.
You know, I'm like you. Anybody wants to practice whatever religion they want, believe in whatever they want. Who cares? We look at people's behaviors. That's that's and so no disrespect. I have a close acquaintance in another state who joined a religious healthcare insurance company funded by his religion. Unfortunately, they had a stipulation, and they still do. Well, if you had a pre-existing medical condition, you can't come to us. Really? Okay.
Yep. Yeah, and that was part of Obamacare as well, is that they were going to do enhanced funding, and this just never really came about. They did the initial funding for it, but they didn't continue the funding. But it was for these medical co-ops, which is just, I mean, another form of insurance that's, I guess, supposed to be kind of trendy, kind of like what you're talking about. It's just this co-op where, and a lot of religions were involved in these co-ops because
Oh,
part of it was that there was these objections, like religious hospitals and stuff were saying, yeah, but we don't. There's certain things we don't want to cover that we would be forced to cover under the Affordable Care Act, and so what if we just use our religious exemptions and we'll start these little co-ops that people can buy into, which again is basically just insurance, and a lot of them fell. They failed after the first few years, but
oh,
same thing. These and let's just be clear. The Affordable Care Act may require insurance companies to cover you even though you have pre existing conditions.
hmm
It does not guarantee you're going to get treatment for those pre existing conditions. That is a whole different story altogether. And you see a lot of insurance companies playing games with this. Where it's like, yeah, no, we'll cover the pre existing condition, but it's still going to cost you. And one thing that I found, and this goes to this point, insurance companies will often go through loopholes, even though that they're required to cover something. They will put doctors and patients through hell. Like, oh, well, we need to get a pre-authorization, and then of course they'll make little mistakes, like, oh, we forgot to file this or that, and what they're really doing is they're trying to run the game out because they're hoping that the patient dies before they actually have to come through with the care. I mean, so eventually, if you live long enough, they'll eventually cover whatever. But they're planning on the fact that they're going to run out the clock on the patient. And this seems to be an increasing scheme that's being used. And again, that's where I went back to earlier when I asked you. To me, I don't see how that's not murder because they know what they're doing. It's intentional strategy. I mean, they're denying patients the care that they need, just saying, well, if we wait long enough, they'll die. Or if we wait long enough, the disease will progress to the point where the treatment that they want us to cover is no longer viable.
so you have what you're talking about is really, it's even sadder. You have lower level employees falling in line with decisions that were made higher up the food chain, supported by other people higher up the food chain, and it's kind of like you saw one of these movies where maybe in Nevada they had access, to the joystick with the drone in another country, and they're exploding it, and collateral damage, and of course some of these people that did that, they did eventually go, gee, it doesn't feel very good to be doing that, but to deny purposely to deny access to quality and timely health care strictly on the basis of let's see if we can play this out and save a little money. What other better definition is there in terms of evil? I mean, I'm not saying necessarily from a religious standpoint, but I mean it seems like a good word. I've thrown out the words a lot. I have to think about it when I do it now. You know, People with sociopathic and psychopathic personality disorders. These might be the same people high up in the food chain who because of having either an average or better than average IQ, but if they have these personality traits or tendencies or disorders, as I just mentioned, you can be very successful uh, with these personality disorder traits. Uh, so then you have the people that are following orders underneath them, and there's no rhyme or reason, but if you're work dependent, I'm not making excuses.
No, I get what you're saying, though.
Yeah, if you're work dependent, your spouse is at home disabled, you've got kids to feed, you've got this expense, that expense. If somebody says to you, well, let's your job is to be the gatekeeper. I I, I guess you get just like desensitized, for lack of a better word. You become immune between what's going on in your brain and what's going on in your heart. What's some sense of empathy for damages that you're causing other people, not only physically but emotionally. I mean, what a strange world we've become.
It reminds me, back when I was younger in California, one of the first jobs I ended up having was a telemarketing job. And it was at this place that was selling this, um, all this way that you can buy this list to get properties that you could get for cheap, repossessed properties and
Sure.
so forth. And um, I had, I think I only lasted at that job a few weeks because, but what really got me was a woman called and she was telling me her story. And of course, we were supposed to follow a script, right?
Of course.
And so this woman is telling me this story. She's like, "I'm calling you from a payphone, and I am on disability. I'm living in this group home, and I'm willing to." Literally, she was telling me that she was willing to almost become homeless to be able to afford this, and I couldn't do it. I just went off script, and I was trying everything I could to talk her out of it without making it seem like I was trying to talk her out of
Yeah.
it.
Yeah.
Because these calls are monitored, and I'm like, oh my god, what am I, But I did not want her doing this, and I couldn't do it. It just didn't matter to me. I'm like, no, I can't do that. So it's hard to understand how, and that's just with somebody that, you know, now my supervisor later said, "Yeah, well, how do you know that this woman wouldn't have maybe she would have gone homeless for a little bit, but she has this list which I thought was absurd because if you're homeless, I don't know what good this list is going to do, and obviously you're not going to be able to buy properties if you don't. But his rationale for it was, well, but this woman might buy the list and she might buy some of these properties really cheap, and next thing you know, she might be doing really well for herself, and by you kind of talking her out of it, you've just destroyed her life. And I thought that is the most absurd thing. But I assume that this is how people rationalize it. They I don't know how that would work in the healthcare context, where it's like, well, I mean, I suppose maybe if you're super religious and you're like, hey, this person's going to get to see God soon, maybe that, but it,
Sorry. Listen, I've been there, but well, first of all, just as an aside, I sold magazines on the telephone, and that was fine. So, but okay, so imagine, if you will. I mean, imagine, if you will, working in a medical center, and you know that an organization called the Joint Commission on Hospital Accreditation is coming in. Imagine, if you will, you work for a federal facility, and somebody's coming in from IG, the Inspector General's office. Or imagine somebody's coming in from the GAO, government, how they, and imagine the the audacity of supervisors, talking to the people that they supervise and say, well, now we can't have anybody, talking, doing complaints. We don't want to lose our accreditation. Okay, guess what? This goes on. So, it's you can't complain to anybody for, because if chances are, if you wanted to complain to an accrediting agency about something that everybody knows about, very few people are talking about, or they're talking a lot about it, but they're afraid that they're not going to get their promotion or whatever. This is what more in terms of healthcare? What more do we need to know? That there's a crisis in morality, there's a crisis in ethics, there's a crisis in integrity, and it's not over how much a shoe costs that's manufactured in the United States, and somebody maybe making $18 an hour making shoes. Okay, we're talking about people's health care. We're talking about do no harm. And chances are, if people are telling you that at a meeting that you can't really, don't say anything to the Joint Commission on Hospital Accreditation, chances are they've been told about their problems for the last 2 years. And now they're afraid that it's some big shot's going to come in. I mean, there's the crisis. And here's where it happens. And we're just talking about healthcare now. It happens at the federal level, the state, the county, and the private sector. It's like this is what healthcare. Why? Money. Because all these federal, county, state, they all have budgets. They don't want to be punished. By the way, as you've said about every profession, there are tremendous people working in healthcare.
oh, absolutely.
We don't, and there's people that have tremendous ethics and tremendous integrity. That's what keeps us afloat despite the flaws. But the flaws do cause unnecessary pain and suffering to people. And that's what this country is going to have to try and come to grips with.
Well,
And
the friend that I mentioned in my monologue, and I try to not tear up when I talk about this again, but um, she has to continue working because if she loses her job, then she loses her health care, and if she loses her health care, then she loses access to the treatment that she's getting, which is it's a new form of treatment that she's getting, that's saving her life, is keeping her alive.
mhm.
What kind of system I mean, just imagine that. This is somebody who has cancer, a terminal form of cancer, who has to continue working and will continue having to work for the rest of her life until the day that she dies, just so that she can have the insurance to keep her alive. I mean, it is absurd and angering to me, and yet we have to say that she is one of the lucky ones, right? In this country, she's one of the lucky ones.
No, I know what you're saying. Well, sure. And the person who lost their job and their health care during COVID, we saw what you're talking. We can see that how it was multiplied over and over and over again about um, the severe lack of human empathy towards people that lose employment through no fault of their own, and then lost their health care coverage, and then now they've got to figure out where do I go,
Hmm.
go through all the hoops and this, that, and the other. Um, you know, some people figure it out and many don't. They thought, oh, Cobra, well, that's pretty expensive. Then there's, the Affordable Care Act, uh, hopefully, the programs that serve people that have lost their jobs and now don't have income. Hopefully, many of them do get some type of insurance, but then of course, guess what? Now, uh, are you in network? Are you going to a provider that accepts this type of insurance as opposed to what they did have? Uh, so when I said we have a caste system in healthcare, uh, that's really it's an understatement in terms of the haves and the have-nots, and the very haves and the very have-nots, and everybody that's clumped in the middle with this patchwork of unnecessary administrative spending is again part of the problem. And if Yale and Harvard or whoever, if they say that this is what our country could save theoretically by having a single payer healthcare system, then, you know, let's take a mental sledgehammer and continue that message and make it happen. People are worried about losing their jobs in healthcare or in insurance companies, and that's a real, kind of fear that some people have. But certainly we don't need to. For instance, when we wanted to get rid of the coal industry in some of the states, and everybody lost their jobs, um, and it started, getting, welfare, of which perhaps they were already ashamed and embarrassed of the word because of the culture that they grew up in. And so they say, oh, look at what happened to the people in the coal industry. Well, so what? How about, just being an intelligent country and government? Oh, we're going to support you for the next 5 years. That'd be a drop in the bucket money, or we will retrain you, or, you can join, whatever. Some people maybe should get, oh, sounds like socialism. Maybe they should, people that get displaced should get a guaranteed income to live on. If you're disabled in this country, you know what people get per month.
Right, and this is, by the way, just for the audience, I am going to be doing an episode on socialism coming up. So you'll be surprised
You're going
where
to,
I
I'm
come
sorry,
out on that.
area. You're
Oh, I
going
was
to,
just saying that I'm going to be doing an episode of the show on socialism
oh,
and
okay.
exposing some of the myths around that. So let's see where I come out on that argument. Surprise, or will you be?
So are you gonna just out of my own curiosity, are you gonna call it socialism? Are you gonna call it democratic socialism? What,
I'm just going to call it socialism.
okay.
Here's the thing with labels, by the way, though.
Right.
People think of socialism, and what they think of is they think of the definition that has been assigned to them either through culture, their experience, or their political biases. We don't need, we can call, we can even take capitalism if we wanted to and reform that and still call it capitalism. So when I say socialism, I'm not, there's no set definition for this stuff, right? I mean, these are economic philosophies. Th- we can have a discussion, and we need to have a discussion about what kind of society we want to live in, and then worry about what the hell to call it. But the socialism that when I say socialism, I'm talking about the philosophy of care, the philosophy of morality, the idea, and this is where it differs in America, right? America is all about this rugged individualism, this, hey, lift yourself up by the
Survival of the
bootstraps,
fittest.
right? And the fact is that's not how it works. That's not how human nature is whatsoever. Um, if you go back to our hunter-gatherer days, what was the most important thing? Competition or cooperation? It was cooperation. If you and I are in back in the hunter-gatherer days, let's say that we've got 20 of us, right? Well, you go out, Dan, and you get the successful hunt for the day, and the rest of us don't. It's in your best interest to share what you've brought back with the entire group because tomorrow I might be the one that gets the hunt and you don't. So if we don't if the idea is if you're not sharing with everybody, then it's almost selfish not to because you don't know that you're going to be successful hunting tomorrow. So this idea of taking care of each other is at its root kind of a selfish idea, but cooperation and we're social animals. We're meant to socially cooperate. So this idea of America, this lift yourself up by the bootstraps and that people can be self-built, is just absurd.
Yeah, it used to be called the Protestant work ethic. That is part of
Right.
what you're talking about. I will send you and introduce you to our may have already forget the guy's name that talks about in general.
Donald Trump?
Uh,
No, I'm kidding.
in general, when just power alone is utilized to get to the top, uh, it fails because of what happens at the bottom, and you, and that has happened a lot with major corporations have only lasted for about 30 years uh, because they just forgot about what's going on underneath.
Right,
And
and that's the thing. I mean, well, like when you mentioned the hospital workers, the people that clean the rooms.
yeah,
Uh, it's easy to say, well, the doctors are the most important. Okay, but you put a doctor in a room that hasn't been cleaned, and all of the training and medical experience in the world isn't going to do much if you've got a patient that's being exposed to bacteriums and viruses. You know, um, so it really has to be a team effort, and that's what people tend to forget. I mean, you tend to ignore the people in the lower classes, like the caste systems, like the people that clean their rooms, but they're just as important and crucial to the system as the doctors are.
some of the best listeners in the hospitals and assisted living homes and whatnot are the people that come in and clean their rooms daily. They're frequently the best the best ears that somebody has had perhaps all day. It's very
Yeah,
true.
it's and so anyhow, so back to that this whole idea of working together and so forth. Um, the same goes for the. I want other people. If I'm getting the best health care possible, I want everyone else to get that same care. It's to my benefit, right? And I don't know how and I think this is probably the one issue that has Americans most divided when it comes to talking about Medicare for all. Because you've got people like, well, why should I have to pay? I'm in good health. I take care of myself. Why should I have to pay for, Jane and John over here uh, when they get sick? And these are the people that are like, well, what about, I've even heard this absurd idea of, I, I, I'm not sure if I'm calling it the right thing. I may be confusing it, but it's something like social health insurance accounts where you basically are given a lump sum for your entire life.
Oh, yeah, I remember that concept.
um, and I'm like, yeah, that's just no. That
Yeah.
that's just
Oh,
absolutely
the,
absurd to me.
the piggy bank. Uh-oh, it's empty. Now what?
Yeah, and I guess you just
Well,
run off
you
and
start a
die.
GoFundMe account.
Well, yeah. I mean, and that right, the fact that people have to use. I mean, if you go on GoFundMe now, it's just enough to make you want to just curl up in a ball and cry. All of these people. I mean, and it's just, is this really? We're told that we've got the best system in the world. Really? Go on GoFundMe, and they're tragic. These stories are absolutely tragic. And yet, this is even in the era of the Affordable Care Act, right? There's nothing affordable about healthcare in this country. And it's not even a matter of, people will say, well, but quality. Again, as you mentioned earlier, we spend more than every other developed country, and yet we're not getting anywhere near the same outcomes other countries are getting. Um, you know, I, there's a in the book that I'm reading, there's a book called "How We Do Harm," and it's written by a doctor who talks about the problems with our healthcare system and the need for and he also talks about not just the need for a comprehensive insurance program, but a need to reduce medical errors. One of the things that is proposed is this idea of, and I mean, I have this view of education in general that it should be funded by the taxpayer funded. But
And
why are
corporate.
we not, when it comes to doctors and nurses, as you say, these are people that we need, and there's a shortage right now, and yet the cost to become a doctor or even become a nurse is just enough to put you in debt. So it's not a big surprise why people are not wanting to go into these professions. So why not have programs? And there's one hospital in New York that is doing this. I think it's New York University, NYU, I think it is, and their program for medical students is completely of no cost. There's no tuition.
Oh,
There's
I did hear about that. I know. Wow, how cool is that?
right, and they're doing that now. They had a grant that they had been investing in, trying to get up, and so they intend to do this forever. But what if we just had a program where we said, hey, look, we'll pay, no cost to you to become a nurse or to become a doctor. The education will be covered, and you can go to a community that is in need of doctors, that has a shortage, a community maybe where most doctors don't want to be, these vulnerable communities, and go there for a period of time. Or how about just,
Not a new idea, by the way. It's just that it never caught on fire.
do you
The,
think that
everything that we're really talking about is it's not new. It just hasn't caught on fire. The only thing that's caught on fire is how can we make more money?
do
And
you think
help.
that COVID is changing the narrative on this a little bit? Do you think?
Well, you'd think that would have been a perfect tipping point, as people talked about. Well, if this isn't the best example in the world, what would be? And you know, I, I I'm not a genius, uh, but when I was writing about this kind of stuff 15, 20 years ago, unfortunately, I talked about the bubonic plague and other things that have spread like rapid fire and what the consequences would be if we didn't have systems in place to deal with these kinds of things. And so I thought, well, here's here, and I would write. I'd say, well, if something happened to a wealthy family and their children got exposed to something contagious by somebody uninsured or who couldn't go get
Hmm.
care because of finances, who's going to whine and complain the most? Who,
Yeah,
and what do? They'll blame them. Well, they didn't work hard enough, and that's why they don't have insurance. Or then they'll say, why didn't the government do something? Well, we can.
yeah.
And
It's the
and
moral obligation.
I'm not saying I like or don't like Bill Gates, but he gave a fantastic podcast about what what's one of the best industries in the world to prevent in the United States rather to prevent fires from spreading, to have a good fire department, regular training, drills, preparation, know your hot spots. Obviously, I'm not talking about California as much, but it's true. And if we had designated systems in place for the next pandemic, and by the way, we all know it's not, will we?
Oh,
Yeah, we will, just
yeah.
when. If we had systems in place like we are prepared for fires, like the Great Chicago Fire, there wasn't systems in place. If there were, and now there are, you go to any major city, just a city. I'm not talking about what we know is causing all the fires in California. And we were told 25 years ago that this could happen. Who's sleeping at the wheel? So, but in cities we have great fire departments. Well, in big cities you can have great centers. And if there's no pandemic going on with all these people that are in place, they can be doing other things in healthcare. So, you know, listen, it was about maybe 30 years ago. We had a governor in California. I'm sorry, I take that back. About 30 years ago, we had a governor in Colorado who was talking about the huge expenses that people over 60 are going to incur in our country because as they get older, they're going to cost more money. Well, by the way, it's very true. But people start then worrying about death panels and ration
Yeah.
care. We're going to have ration care. Well, we have no finer example today of ration care for no matter what your age is. You
And the
can,
death panels, by the way, we call them insurance companies.
thank you. There they are.
And
Hey, listen, this has been rewarding for me personally. I hope all your listeners have enjoyed or didn't get teary eyed listening to the whole show. And people are going to say, well, fine, they're just experts in talking about what's wrong. What are you going to do about it? And I'll say this to anybody that's listening: what are you going to do about it? Vote. Go to support people that at least in the beginning they say that this is what our country wants and this is what our country needs, and hold their feet to the fire once they get in office. That's number one. And then we have to get money out of the politicians who can accept money from all the healthcare corporations and the pharmaceutical until that becomes because it's legal now. Uh, and once there's a line in the sand saying no, you're not going to do that, then we can move forward. So that's the second thing. And the third thing is let's not lose hope. Let's continue to, even though people think that this is a very hopeless situation because of how the systems have become contaminated by money and by greed. They have been, but you got that flag behind you, and it means something to a lot of people, no matter what their religious, spiritual, ethnic, agnostic, atheist, whatever, doesn't matter, beliefs are. Um, we can have the best healthcare system in the world, and
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 there's
it will
nothing more patriotic than caring about your
totally
fellow
patriotic. What?
citizens.
Yeah, I mean, it's despicable to all the things we've talked about that are tolerated. And, it shouldn't have to come to well, until it happens to you, then you'll wake up or your neighbor or somebody and go, oh my gosh, how could that be? Well, okay, so I'm off my soapbox. Is there anything, last minute question, comment, or concern that you would like to ask me
So,
before we call it a night?
so my friend was able to, I talked about her ability to kind of do some comparison shopping, even though that was incredibly hard to do.
No, sure,
Are
she had
there
the skills.
Right, but are there resources, or are there websites, are there places that an average person can go to inform themselves more or to learn about? I mean, how what resources exist out there other than yourself to sort of navigate that system?
Well, this isn't not my personal pity party here, but I have had difficulties in accessing quality health care over the last 20 years. I know physicians who feel the same way. Having said, and nurses, and it doesn't matter, and friends and family. I mean, by the way, let me just say something that everybody should know. If anybody ever ends up in the hospital, if you do have somebody close to you that can, keep in touch with you and your healthcare team, and make sure that unintentional, accidental errors don't take place. It's always good to have somebody like that. To answer your question, are there resources available? I guess there has to be, and I just I'm kind of like drawing a blank. Ask me that question one more time, and then I'm going to take notes, and then we will revisit this, because what I've been doing a little bit pro bono, one patient, one family at a time, is I just literally I'll go to Google, or I will. Uh, I hate giving out names and telephone numbers. I always did, of organizations that say they're going to help, because things can change in a minute. They
Yeah.
can change in an hour, and there's nothing worse than somebody being in a bind, and then somebody, one of my complaints about the field of home health care and my profession is you'd have people giving out, community resources like this. Here's a list of names and telephone numbers for you to call. Well, chances are these patients and families, they're already under stress. Now you're going to say, here, check these out, call these folks. So I would, pat on the shoulder. I would never put that burden on people. I would call up the organizations and find out, am I going to get jerked around? Because if I'm getting jerked around, you know what's going to happen to the patient or the family. You know, then there's organizations like 211, good organizations funded by, I'm starting to think, funded by United Way. And it may not be the number 211 in everybody's community, but there's something like that. Information and referrals to find out, for instance, we were talking about a free mammogram, or uh, a breast cancer foundation that will help somebody and guide them through treatment. there really are a lot of good organizations out there, but for me to give out at this point in time mass education, which which could be totally bogus because everything changes, especially the best example I can think of, and I've heard this, and I have to verify this, pardon me for my sick humor, but I hear like, everybody will call up the suicide hotline number. And then I hear they get numbers to call or this, that, and the other. And then they call those numbers. And it's like sometimes they're like getting misinformation with a suicide hotline. I don't know if that's true. I might I might test that system one day to see, whatever. Or you call up the Veterans Administration. If you're feeling like you're suicidal, call this number. I'd like to see what happens because suicide is one of the 10 causes of death in the United States. Let me just say this.
especially among children too, children and
I know. Let
vets.
me say this. If somebody's made a decision to kill themselves, with or without warning, they're going to do it. So if you're a victim, a family member of suicide, you know, why didn't we see it? Why didn't we know? It's easy to say it's not, it's really not your fault. But guess what? If an adult has made a decision or a suffering adolescent, you didn't see it, please, that's the time to go get some help and figure out that, there's a reason why you didn't know. They're called secrets. Everybody has them.
Yeah, and often
You didn't think
too,
I was
you're
going to be
so close to a
talking like that, but
situation, you're not seeing, you know, it's become normalized over time, so you're not always seeing the signs. Whereas somebody outside the family might be able, might more readily recognize some of the symptoms too.
of course, of course. But back to community resources and helping people. I was just kind of daydreaming out loud with you. Um, it might be worth revisiting in a different time frame, a different format. Uh, you want to do educational classes, and so like access to community resources for all these organizations who, by the way, are suffering. There's probably
Absolutely.
not a organization around that isn't hurting, whether it's the American Heart Association, Lung Association, Multiple Sclerosis Association, Cancer. Everybody is struggling. I'll tell you a little secret. I called up the Ombudsman program where I live because they were advertising on TV. And I called them up and I left a message. This is the Ombudsman program. These people go into nursing homes and try and do problem solving. I never got my call returned. What does that tell you?
Wow.
And I said, "Hi, this is Dan Lehrman. I'm a retired licensed clinical social worker." And blah, 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 blah. I never got called that. But they're spending money on TV to advertise their services. What happened? I don't know.
Yeah, a lot of you hear a lot of negative things about nonprofit organizations, and being the co-founder of one, I just want to make disclose that. Um, but
Well, I've been one too.
a lot of the problem is, and there is the administrative apparatus that sort of exists if you're a nonprofit is just a huge burden. I mean, there needs to be a lot of reforms done in that area because the smaller that you are as a nonprofit, these dealing with the government and doing these filings and all of that other stuff. I mean, again, as a small organization, that becomes a huge and expensive burden. But there are so many nonprofits trying to do such a great job,
Oh, I know.
and unfortunately, everyone is competing for what? Money, right? You need money to do. I mean, a nonprofit needs money to do what they do to serve their mission, and who are they relying on that money from? More often than not, it's the general public, and so it's sort of contradictory when you think that an organization that's let's say, does a food bank or deals with the homeless. Well, when economic times are good, those nonprofits might be well sustained. But during the times of like the Great Depression or times of economic strains on the average people, those donations suddenly kind of dwindle, right? And so now it's a very vicious cycle. And there are a lot of nonprofits that are trying to do their best, and a lot of them are going under too. And COVID has impacted nonprofits particularly hard.
And yet, private corporate donors to certain organizations really, if I just read this correctly, the larger organizations are corporate donors and private donors too. I mean, if we were to Google how much money goes into donations to nonprofits, it's huge. I mean, it's huge. I forget what the number is, but it's really huge. So yeah, but I again, I've done probably, well, not probably, I've done over 4,000 home health care visits as part of my part-time career, uh, and again, you can't go into somebody's home and give them a list of numbers to call because something not good is going to happen. And then the organization that is sending in good nurses and nurse case managers, physical therapists, it's not good. Um, so I would always be leery about giving out numbers unless they've been verified. And then if they tell you, well, yes, this is a good number, but we need to refer you to somebody else right now, okay, then call that number and see, is that good? Because, free advice is great, but sometimes, you got to follow the proper administrative trails. And there's a tremendous amount of well-meaning people that say we do this, but they can't for whatever reason. And you need to know before, you refer them to somebody. Um, so let me think more about that. I like the idea of a team, a coordinated team down the road with a physician, an advanced registered nurse practitioner, and somebody in the social services doing one of your courses in a team approach about accessing healthcare. What do you do if there's a problem? These people that were afraid to complain about the hospital, people are so afraid of retaliation.
And the
Hey,
nursing homes too.
pardon?
And the nursing homes too.
Oh, I know. Oh, perfect example. Grandma wasn't taken very good care of. Oh, well, let's tell the administrator. No, because everybody's afraid that now something even worse is going to happen. In healthcare, uh, you know, I, I, I don't know.
Yeah.
Your good
Well,
health.
yes. Thank you so much for joining us today. And again, we're going to have you back because healthcare is going to be a strong focus of this podcast because it is such a crucial issue and it's a very complex issue as well. Um, so please leave us a comment down below and let us know what you think. And if you've got any questions so that in future episodes we can ask Dan. We're going to put Dan's mind and experience to good use. Um, Again, thank you, Dan. I want to thank all of you out there for listening. We will be back next Tuesday. I believe next Tuesday we're going to be talking about capitalism and socialism. More
Before
socialism.
before we hang up, I will. I'll just say if somebody has a pencil and paper, if you want to give me a call and chat about something here, and you're not interested in ripping me a new one,
Or
you
trying to sell you a magazine subscription.
yeah, you can call me at 1-561-503-1403. Dean Lehrman. Again, that's if you want to talk serious. I mean, if you think like, uh, I'm I've got the wrong agenda for our nation, that's okay. Just, don't call me. And
That's what the
otherwise,
comments are for.
yeah, yeah, right. All right. Goodbye. Good
Thank you,
night, you
Dan.
guys.
Goodbye.
Be
Ladies and
safe.
gentlemen, yes, be safe, be healthy, and please be kind to people. We'll see you next week, next Tuesday, Coup Save America. I'm Sean St. Hart. Have a great week.